Okay, so this afternoon we have a very interesting talk given by Assistant Professor Jean Liu. She's Assistant Professor in Psychology at the Yale-NUS College. So at Yale-NUS, she was the head of studies of psychology, and also she was a residential fellow. And currently her research focuses on digital well-being and how advances in medical technology interact with the broader social context. And within this remit, she leads the research group, the Synergy Lab at Yale-NUS College, which addresses both basic science and translational topics by incorporating data from randomized controlled trials, surveys, experience, sampling, behavioral paradigms, neuroscience, and also digital devices. So in her teaching capacity at Yale-NUS, she does quite interesting work also, incorporating it into her teaching. So she focuses on behavioral insights, so what would be more commonly understood as nudge theory, which is how an understanding of psychology can actually optimize public policy and product design. So as part of her teaching, she also regularly partners the government, NGOs, and also the private sector in student consultancy projects. And she also teaches a flagship course where students conduct randomized controlled trials to solve real-life policy challenges. So, and in addition to her research and teaching, she sits on government advisory committees pertaining to health, and also you might have seen her in some of the public forums and also in media. So today she'll be presenting to us a talk on Beneath the Veil, examining private chatter on WhatsApp during the COVID-19 pandemic. Yeah, pass the time now to Jean.
Thank you, Sam, for having me here. Sam and I have many areas of research in common, and I'm very excited to be here and present my research. So yes, the title of my talk today is Beneath the Veil, examining private chatter on WhatsApp during the COVID-19 pandemic. So let me tell you about the research that we did. The basis of this research is that, we often think that what happens on WhatsApp stays hidden beneath a veil. So WhatsApp is the most used messenger app. It is used by 2 billion active users across 180 countries. But despite it being so widely used, WhatsApp also boasts that it has this end-to-end encryption such that their private messages sent through the platform can only be seen by senders and the recipients. So basically, all your activities that go on WhatsApp stay hidden. The problem with that narrative, however, is that in times of crisis, the impact does not stay beneath the veils. It does not stay hidden. So let me give you a couple of high-profile examples. So in 2014, there was a kidnapping incident in Israel, and there was a gag order placed on it saying that, please, this is a live case, and we don't want any rumors to be spread, and we don't want any information to be spread. However, very quickly, as you see in this headline, throughout WhatsApp, people were spreading what the teenagers' names were, what the phone numbers were for the families, and they even spread false news about a rescue. And so this is a problem where the impact did not stay beneath the veils of WhatsApp. And how about during the 2018 Kerala floods in India? Well, in the midst of the flood, people were panicking. And again, they started communicating through WhatsApp with social consequences. So for example, someone spread a fake phone number that you could call if you wanted a rescue helicopter to come and get you, which of course, that if that's not actually true and is being spread on WhatsApp, it has consequences that go far beyond the platform itself. There were also rumors being spread on WhatsApp of a dam bursting, causing a lot of panic. Of course, closer to home in the last 2 years, we've also seen that throughout the COVID-19 pandemic, rumors spread through WhatsApp, information and messages spread through WhatsApp did not stay within the platform itself. And so all over the world, you see headlines such as this. For example, this headline in Singapore, there is no lockdown. Lawrence Wong debunks WhatsApp rumor about COVID-19. And how about all these about COVID-19 and WhatsApp fake news in India? And then WhatsApp responding to the Indian government about their rules regarding India's request to break the encryption as a result. So in other words, what I've been presenting to you is that despite this claim that, whatever we do on WhatsApp stays beneath the veil, inside, hidden, contained in the app, the real life consequences of this information spreading, of these messages spreading, actually goes beyond the app. So my research group decided that we really needed to understand how crisis-related content is spread on WhatsApp. The typical method that had been conducted previously is through case studies. So for example, we go backwards and see, hey, there's this high profile case where information was spread on WhatsApp and it had consequences outside the app. Let's go back and review what actually happened. So a case study. Sometimes people interview those who were spreading WhatsApp messages in a crisis, or we conduct surveys. But as many of us know, in these methods, we are limited by our memory, our selective attention to details. And so what we really need is live tracking of content as it happens. So our team came up with a novel method where we decided to use daily diaries. So every evening for 7 days, we wanted participants to review their WhatsApp chat history and on the go report their COVID-19 chatter for the day. In particular, we were interested in a couple of WhatsApp-related activities. We wanted participants to count how they had forwarded COVID-19 content. So we asked them every day, count the number of unique messages related to COVID-19 that you had forwarded and the number of persons you forwarded to. Okay. We also did the other way around. So how they had received forwarded COVID-19 content. So tell us the number of unique forwarded messages you received, the number of people you received from. And finally, we also asked them, how many conversations did you engage in regarding COVID-19 on WhatsApp? I'm going to present the 2 studies that we did using this method. The first study we conducted with a small sample, 150 participants from Singapore. We tracked them for 7 days during the circuit breaker in 2020. And this was conducted in English. In study 2, we're about to publish it. We repeated our study with 1,000 participants from India last year during the second wave of India's COVID-19 crisis. And this was conducted in both English and Hindi. So let me first start by telling you about our Singapore study. So when the pandemic first hit our shores, we decided that we needed to track what was going on in terms of WhatsApp communication. And so we recruited a small sample of 150 participants. And this was during a time where we knew that the COVID-19 chatter on WhatsApp was very, very high. So as you recall, if you take yourself back to the early 2020, there was a rising number of cases and people were panicking and so messaging each other a lot with updates about information. During the period that we studied, the Prime Minister also introduced this enhanced measures, which was essentially our lockdown or our circuit breaker. And again, people were sending a lot of messages about the situation on WhatsApp. And so during this time of high COVID-19 chatter on the platform, we wanted to capture this communication live. So the first thing we asked participants was, okay, where are you getting your COVID-19 news from? So more than 60% of people were getting it from news websites or app, but you can see over here that WhatsApp was the second highest source of information. About 1 and 2 participants were receiving their news and, about COVID-19 from WhatsApp. So as you recall, we tracked their usage across 7 days. So every day we messaged them to say, hey, tell us about your COVID-19 activity on WhatsApp. And what we found was during the week, almost everybody reported at least one form of COVID-19 related use on WhatsApp. Many people were receiving messages. They tended to receive much more messages than those that they shared. And if they forwarded messages, they tended to forward them to individuals more than they did to groups. So what we were then interested in was to try to work out whether there was a taxonomy of WhatsApp users. So based on all these activity patterns, could we use a bottom-up statistical clustering method to come up with some sort of taxonomy? So indeed, we could. And what we found was that there was about 1 in 10 WhatsApp users who are what we call chronic users. They were responsible for the bulk of COVID-19 chatter. And you can see they're very high on each of the activities, whether it's the number of messages forwarded, number of messages received, number of personal chat discussions. They're just very, very high on COVID-19 chatter. When we tried to identify who these people were, we found that they tended to be married, they tended to send texts throughout the entire day, and they tended to have lower confidence in government. The other categories of users were also interesting to us. We found that about 1 in 3 were receiving users. So they actually received quite a large volume of COVID-19 chatter, but they didn't spread that on very much. This group of participants tended to be married and older, so over 51 years of age, or they were single with moderate levels of fear about the situation. And then we had the discursive users, about 1 in 3 participants whose main activity was primarily engaging in in group chats about COVID-19. So they weren't forwarding and receiving a lot of COVID-19 messages, but they were engaging in conversations about COVID-19 on WhatsApp. This group of participants tended to be single, or if they were married, they were those with very high confidence in the government. And finally, about 1 in 4 participants were low on all behaviors. So they engaged in very little COVID-19 chat on WhatsApp. They tended to be married and younger, or single with moderate fear levels about COVID-19. So that's all very interesting. But as I mentioned, at that point of time, we only had 150 participants captured at one time point in one country. And we were very curious to see whether our patterns would generalize to a greater number of participants in another time point of COVID-19. And so we repeated our study in India last year with 1,000 participants. Again, as you recall, there was a period of very, very high COVID-19 chatter on WhatsApp at one particular time point. And that was when India was experiencing its second wave sometime in the middle of last year. And so, all around the world, there were these kind of headlines, how India descended into COVID-19 chaos, India is spiraling deeper into crisis, and there were calls for international aid and more oxygen tanks and so forth. Several of my lab members come from India, and so we decided as a team to understand what was going on over there in terms of WhatsApp communication. Again, the first thing that we did was capture all the WhatsApp activity and try to use a bottom-up statistical clustering method to obtain a taxonomy of WhatsApp users. Similar to our Singapore sample, in fact, very, very similar in terms of the percentage and in terms of the patterns of activity, we found that about 18% of our users were chronic users with very, very high level of WhatsApp engagement pertaining to COVID-19. So as you can see, this is the green bar over here, and whatever metric you use, they just had higher activity of it. Okay, so the Singapore population, we found that this was 14%. Here we find that it's 18%, so very, very similar in numbers. We also found that about 1 in 4 participants were minimal users. That's the red line over here. And you can see that whatever metric you take, they have hardly any WhatsApp activity related to COVID-19. Okay, so very similar to the Singapore sample again, a bunch of people who just don't engage in WhatsApp chatter about COVID-19. What differed, however, is we didn't have the other 2 groups that we found in the Singapore sample. Instead, we just found that 6% of participants were moderate users whose activity are almost parallel to the chronic users. You can see that the line is almost parallel, just attenuated, with the one difference that they're slightly more likely to engage in group discussions than personal discussions. The other distinguishing feature of this data set as compared to our Singapore data set was that, these three clusters accounted for about half the participants. There was another half of the participants whose WhatsApp behaviors could not fit in so nicely in the taxonomy. In fact, we needed another 36 different clusters or categories to identify their patterns of WhatsApp usage. Nonetheless, the three groups overlap quite similarly to the Singapore clusters, and they're the groups that we're going to focus on for the rest of today's presentation. Because this was our second study, we were able to insert a lot more questions to try to understand the nature of the WhatsApp use and the nature of each of the users. So one of our questions was, why are we finding these kinds of patterns of users? Are our chronic users just people who use WhatsApp a lot in general, and it has nothing to do with COVID-19 content? Or are they, specifically users who want to engage in COVID-19 content? So the first thing that we asked participants was, what's your frequency of WhatsApp usage? Okay, so in general, do you use it, yearly, monthly, weekly, multiple times a week, daily, multiple times a day? And again, I put out the categories and the color codes for you. And the thing you should realize is that regardless of what color code, whether you are a minimal user, a moderate user, or a chronic user, you can see that everyone is actually quite a heavy WhatsApp user. Okay, so the majority of participants, of our 1,000 participants, were using WhatsApp at least once a day. So they're all heavy WhatsApp users. And the distinguishing feature is that the chronic users like talking, engage a lot more on COVID-19 chatter on the platform. It's not that the minimal and the moderate users just don't use WhatsApp in general. It is that they choose not to engage in COVID-19 chatter. So what seemed to matter in terms of identifying the chronic users is whether they see WhatsApp as a source of news for them. So you can see over here that the green bars, the chronic users, were much more likely than the other two groups to report that they often or always or sometimes use WhatsApp as a source of news. Okay, so they are not differentiated in their baseline activity. They are differentiated in their reliance on WhatsApp as a source of news. So we were quite concerned about this pattern, because throughout the COVID-19 pandemic, people have linked turning to social media for news as a risk factor. So for example, here's a new meta-analysis that just came out in January this year across 47 studies. They concluded that, individuals who obtain COVID-19 news from social media as compared to your traditional news media had higher levels of anxiety. So there's this link between obtaining your news, COVID-19 news from social media and being at risk. We were concerned about a particular kind of risk. We wanted to know whether chronic users were at higher risk for fake news. As many of you know, throughout the entire COVID-19 pandemic, there has been a lot of fake news. The World Health Organization has a whole page of FAQs addressing some of these claims. For example, eating chicken causes the spread of COVID-19. Is that true or not? Can eating garlic help prevent COVID-19 infection? True or false? There have been many of these rumors. So what we did was we took 8 rumors that were being spread very widely across India during that time. And we asked them, how many of these 8 rumors did you believe? And how many of these 8 rumors did you share? And what you can see over here is that, we were concerned, are chronic users at high risk for fake news? They seem to be. So relative to minimal users, both moderate and chronic users tend to believe more COVID-19 rumors. But in particular, when you ask them, how many of these rumors did you share? The chronic users were much more likely to share some of these COVID-19 rumors on WhatsApp. So again, we were curious. So, having categorized our users and coming up with a taxonomy like this, what do we know about each user type? So this time around, we managed to ask a lot more questionnaires, trying to profile them in terms of psychological measures, trying to understand the demographics a little bit better. we're very good at distinguishing the minimal users. So remember, the minimal users hardly engage in WhatsApp activity related to COVID-19. They were much more likely to be single. And in terms of their psychometrics, very similar to the Singapore sample, they had very low levels of fear about COVID-19, and they hardly thought about COVID-19. So very, very similar. You tend to be a minimal user if you just don't think about COVID-19 in general in your day-to-day life. On the other hand, the moderate and the chronic users were much harder to profile. We only, in terms of demographics, the only thing that we can say is that they are a little bit more likely to be female. But there's no difference in the whole bunch of questionnaires we gave them. I mean, you might think, for example, that maybe they're much more likely to be conspiratorial. They might think that people are always having coming up with they're much more likely to come up with conspiracy theories. But no, that's not true. You might think that they might be differentiated in personality. No, that's not true either. You might think that maybe in terms of how they relate to information, they might be distinguished. That's also not true. So the only thing that we can tell you at this stage about these users is that they're more likely to be female by a little bit. The other side of this question was we also wanted to ask, are forwarded messages of high risk? We were interested in this question because on Twitter, there was a large study of 4.5 million posts, and they found that misinformation was 70% more likely to be shared, which means that if you take any retweet, any single retweet, it is more likely to contain false information than accurate information. Now, we don't have that information in WhatsApp, except anecdotally. WhatsApp in 2020, the app developers themselves acknowledged that there was a large increase in forwarding activities alongside the spread of information, misinformation. And so the app developers were concerned themselves, and they decided to tag at the start of the pandemic, you would recall, some messages as forwarded or forwarded many times with different rules about the extent to which they could be forwarded as a result. Are forwarded messages of high risk? We are still on the drawing board and trying to analyze these messages, but we asked participants, tell us the most recent forwarded message you received or shared. So copy and paste it here. And so far, what we saw was that some of them were false information or rumors. For example, breathing in hot air from sauna or hair dryer can kill the novel coronavirus. But on the other hand, some of them seem to be just factual, like Telangana records 800 new COVID-19 cases and 7 deaths. Similarly, we asked participants to copy and paste to us the most recent forwarded messages you received or shared. And again, we have a mix of both. For example, on the rumor side of things, you can beat the virus with warm water, salt, or vinegar. This viral message claims that coronavirus, before it reaches the lungs, remains in throats, and so forth. On the other hand, there's also informational messages. For example, your vaccine is scheduled at tomorrow at 9 a.m. We haven't actually analyze this data set in full. We are in the process of translating the Hindi messages to English, and then we're in the process of coding them for various themes. It's a very labor-intensive process, so stay tuned for that bunch of results. So what I want to summarize then is that across 2 studies, we have documented how what happens on WhatsApp does not stay beneath a veil. Why? Because WhatsApp is a key source for updates during crisis. And in fact, during the pandemic, we saw that there were several official WhatsApp channels that take advantage of this. The WHO came up with their own one. But of course, many of us are also familiar with the gov.sg WhatsApp channel. And our lab has actually done some research on that, showing that if you get your news from the official channel, it actually predicts lower levels of anxiety. The other thing that we found during this our 2 studies is that chronic users are of concern. About 14 to 18% of WhatsApp users are these so-called super spreaders, and we should try to find out more about them and try to address them in crisis. as I end off, I also want to acknowledge that this space is very dynamic. Just in this month alone, in April, WhatsApp released 2 different sources of news. You can see over here, WhatsApp is testing further restrictions on forwarding messages throughout their app. And also WhatsApp in this month launched their communities feature. So you can see over here, you now can go on WhatsApp and create community groups for your neighbors, for SUTD, and so forth. How all of these changes impact crisis communication remains to be seen. So this is a very dynamic space, and our research needs to keep getting updated as a result. I want to end off my slides and open the floor to questions. I'm very interested to what you have to say, but just before I open the floor to questions, let me just acknowledge I have a fabulous team of collaborators in the NUS Department of Psychology. I work with Addie Chong. In the NUS Department of Statistics and Data Science, I work with Maria De Irio and her team. In my own research lab, the work of translating to Hindi, rolling out questionnaires in 2 languages across from overseas to Singapore. It was very, very complicated. We did that in a very short amount of time, and I have a fabulous team to thank. So let me end off with that.
Thank you, Jean. Thank you for the presentation. Indeed, it's very exciting work because WhatsApp is the platform that we use every day, right? Whether it's for our personal conversations or even now at work, we have various WhatsApp groups. We're always using WhatsApp. Yeah. So we'd like to open up for questions. You can either ask your questions by unmuting yourself, and preferably also with your video on so we can see who's asking the questions. Or you can also type your questions into the chat box, and then we can have a look at it, and Jean will be able to address them. So to get the ball rolling, I wanted to ask some questions. You looked at WhatsApp, right? But that's one of the many platforms that we are using today. So for example, Telegram is another one that emerged after WhatsApp changed some of the policies. A lot of people moved to Telegram. And also we have Facebook, Messenger, and also even those that are less mobile oriented like Reddit. So do you think your findings would actually apply to all these other platforms also, or might it be specific to WhatsApp?
That's $1 million question. We always ask ourselves in this changing technological landscape, to what extent are our findings generalizable? I think there are some things that we have carried on even from Twitter. So as I said, the forwarding tendencies, forwarding messages seem to be something of high risk, and also on every platform, similar to Twitter, we see this bunch of super sharers. That seems to be true on WhatsApp as well. So because it's we've seen something on Twitter repeat itself on WhatsApp, even with its encryption policies, I think that these kind of patterns should generalize to Telegram, to Facebook Messenger. Of course, that's my guess right now. More research needs to be done. It is surprisingly difficult to conduct research on private messenger platforms. So we chose as a strategy to go with the most popular one first. But we hope that other researchers will follow in our footsteps and look at all these other platforms.
We have a follow-up question also in the chat box. Just read out the question from Losa. He or she is asking, did you observe any interesting trends or differences between both your studies, right, with the Singapore population and also the Indian population?
So there are so many differences in the context of both studies. I mean, it was 1 year apart, the governments of both places, the number of cases, the healthcare systems, they're all different. And so when we actually found things that were similar, we were very, very encouraged. Let me tell you the things that were similar across both. The things that were similar across both is that we found 14 to 18% of people who were chronic users on both. That was very, very encouraging. We found that, about 1 in 4 participants were, WhatsApp users who just didn't engage in COVID-19 content on both studies. Again, that's very encouraging that, there seems to be these generalities in WhatsApp user types across all these different contexts. We found that, in both contexts that how much you feared the COVID-19 situation predicted your WhatsApp usage. Again, that's found across both contexts. There were subtle differences. As I mentioned, we found 4 categories of WhatsApp users emerging quite clearly in the Singapore study. We only found 3, and with the third, the discussive and the didn't quite come out in the India sample, and we instead found a moderate group somewhere in between. But the extremes are much more robust. So I think with 2 studies, with more than 1,000 participants, with 2 studies now, I'm quite confident in saying that I think that the extreme patterns are quite generalizable, yeah, so that gives me confidence that despite all these different contexts, we actually see the same patterns.
If anyone has any other questions, you can just jump in, but I'll just carry on by asking a further question to that is, if we see kind of this consistent pattern, right, of the chronic users and then the minimal users, and then most people are just in between there, there will be some implications for policymakers especially. And in Singapore, we rely quite heavily on WhatsApp to actually disseminate official information too. And the government's Reach Group outfit has also its own WhatsApp mechanism where they do focus groups and disseminate information. So would there be anything that they should be looking out for when using WhatsApp as a platform? And also, this will apply very much for most of our attendees today, the researchers, right? We're also increasingly using WhatsApp for our own research. So do you have any recommendations for using WhatsApp?
Yeah, my first recommendation is that I actually think that the Gov.sg WhatsApp channel started at the start of the pandemic was a very good strategy, because it capitalized on the fact that people were using these anyway. So, if you now co-opt that system that, could be communicating misinformation, and you co-opt it to be able to share accurate information, then you're likely to get success. And I think one of our other studies certainly suggests that people who were getting their news from the WhatsApp official channels were buffered from the stresses of the pandemic early on. So I certainly would say that. But the other implication of our findings, I think, is that it's worth figuring out who their at-risk groups are and addressing them. You would see that, a lot of times it's related to their pre-existing fears or thoughts about COVID-19 in the first place. So it's not so, addressing that and getting a general trust in the government's response to this pandemic, for example, is important, right? Because I think that, people's fears drive many of these behaviors. So I think there's a hand.
Yes.
Hi there. Thank you, Jean, for a very interesting talk. My name is Sumbul Khan. I'm senior research scientist working on design education. And I thought your talk is really, really relevant given the pandemic, the fears that it kind of brought up in the general public and the rumors. And we see that, of course, we've seen in the news, especially in countries like India, that, a lot of rumors are generated on WhatsApp, and they kind of have a knockoff effect on real life issues and how things are tackled in the world. And in a few cases, we've also seen that these WhatsApp rumors can also trigger riots or fightings or murders. It can get as drastic as that. So I thought that your study on understanding users and the users who are sharing more, as well as helping maybe unconsciously in spreading the rumors. It's quite interesting. I wanted to know if you thought that education and socioeconomic background of users could have some impact on how they believe the rumors and how they're sharing information or misinformation, and if you tackle that in your study.
Yeah, so what I didn't present is that we've actually looked at rumors in general, COVID-19 rumors and the spread of rumors in two larger studies. One, 1,000-person study with the Singapore general population in March 2020, and then another one with migrant workers also early in the pandemic in 2020. And what we found across both is it's quite interesting. Education is a predictor, but in a funny way. People with more education tend to be exposed to more rumors. And yet they're also the ones who are less likely to share and believe rumors. So there is a something about general education over there. And I think other people have looked at the role of teaching epistemological knowledge, this idea of how knowledge comes about, and finding that actually addresses rumors belief. Yeah, that we also found in those other studies a funny pattern that sometimes rumors are shared even when they're not believed. So in the Singapore sample, for example, one of the rumors that we asked about was, I believe that, COVID-19 was manufactured as a bioweapon in the US lab and in the Chinese lab, where we asked both of them. And these were widely shared, even though you ask people, do you believe them? Nobody believed them. So sometimes, there's this funny thing, right, going on. So you have to actually address not just, people's likelihood to believe it, but which understanding of how knowledge comes about seems to address that. But, if they share it without even believing it, then that's something, a totally separate process that you have to address as well.
Yeah. So yeah, I kind of understand what you're saying about, sharing while believing. So while they might not be believing. So it is about the context of sharing as well, right? Because I might just forward a message, maybe I find it funny. I'm forwarding it, but the other person believes it.
That's right.
So maybe it'll be interesting to see research that probes into the act of sharing itself and the context of sharing. So thank you very much. It's interesting. Thank you.
Okay, thanks for your comment. And I think I have another hand, right? Yes.
Yes, Sandra.
Hi, Jean. My question from a social studies point of view, I'm a freshly new PhD student as well, and I also have a digital safety tool that I helped develop, and I'm very interested in understanding. We're looking at WhatsApp and all these messaging platforms, right? It's all tech. How are the tech platforms? Were you able to share your knowledge and your results with tech platforms? I'm interested to know this, number one. Number two is, how positively are they responding to it? And do you think, I love how you gave the example of how tech platforms are stopping misinformation. Like, for example, the forward functionality, right? To say that how many times it's carried out. Do you think tech platforms have done enough to keep away from all this misinformation, knowing what you do now?
Let me answer those questions in part. Have we communicated it? We have been in touch with the Meta group at different time points. This particular findings, we have not communicated with them, but I think they are aware. As you mentioned, they did change their WhatsApp forwarding rules, and they are changing it they are testing it out to change it this month as well. I think that there is a level to which it goes beyond the platform, because if people are anxious, they can copy and paste the message too, and people actually do that on some of the other platforms where you can't share so easily. The sharing button certainly facilitates that, but underlying these behaviors is fear, right? Often, or pervasive thoughts about a crisis, and I think there's a limit to what platforms can do on that end. we have also communicated our findings to MTI, communication, Ministry of Communication colleagues, and again, I think they have capitalized on WhatsApp, knowing these dynamics as well, independent of our research. So I think these are all ongoing communication. It's funny because I'm right now writing another paper. In fact, just penning the last words before this talk on evaluating Facebook's well-being tools that they built in, right? So often what happens is that people complain, and then the platform then says, okay, based on all the expert comments, I'm going to build in these features. But then after that, nobody actually asks, are they effective? So for example, in this whole concern about digital well-being recently, a lot of the social media platforms have now introduce well-being tools which allow you to just track how much time you have spent on the platform. But nobody has evaluated them. And we just did an evaluation where we said, hey, just because you know how much time you spent does not predict decreased depression, anxiety, or stress. So I think there's a lot of gap. The gap that I think is there is not them responding, but them, the evaluation that comes from that. You might think that based on a very good idea, yeah, I've introduced a feature, but did it actually stop the target behavior? May not be. And I think that, WhatsApp introduced their forwarding caps before, India had its crisis, for example. Did it stop the spread of rumors during the crisis? No, did not. So I think that the gap is, good idea, good implementation, but there needs to be the evaluation and the feedback look up after that. That's not happening fast enough, I think.
Community responses, right? How the efficacy of it or something. Just one more question, because I'm a parent myself, and my children are about 8 and 11, so they're starting to use the phones. And the question is, they're also using WhatsApp as well. And you know how they're forwarding messages among themselves, right? So would you also consider that there's differences between adults sharing information versus the children, adolescents type of sharing as well? Because that sometimes is also misinformation as well, right?
Demographic changes in how these patterns. I mean, you saw that age group was one of the factors that kept coming up in my study, right? Like in terms of the user type. So there's definitely demographic differences in how people are sharing the information. My study has never looked at adolescents for this misinformation piece, but it's quite interesting that you asked that question, because I always supervise high school students, and through this MOE scheme for humanities and social sciences research. And when the pandemic started, I supervised a couple of students who originally wanted to look at this question because they said that on Instagram stories and TikTok, their friends were sharing fake information. So the platform may change, but people they're still sharing on their stories this information, and then they go, what, that's clearly fake. So I think at some level these are all occurring across the demographic groups, but then there are also the form of which seems to be different across demographic groups. There was a study on Facebook fake news which found that the over 60s were most likely to share misinformation about the elections. So there are certainly some demographic trends, but it seems that this is the indiscriminatory behavior in that sense.
It's almost talking about digital literacy already, right?
Right.
Yeah. Thank you so much, Jean. I'd love to hear more about your work.
Thank you. Touch base after this talk. So Samuel, there's a couple of questions in the chat.
Quite a few. Maybe we can address Shun Yuan's questions first on the methodology that you used, right?
Okay, so the method that I use, the daily diary study, that's quite common in other areas of psychology. I did not invent the experience sampling method. The daily diary method was first developed by psychologists studying things like happiness. So they wanted to see your daily happiness, does it change a lot? But it's fairly uncommon in the social media space and in the technology space. But the advantage of it is that you don't rely on self-recall, right? So imagine if I ask participants, at the end, like now, okay? Over the last 2 years of the pandemic, how much WhatsApp did you use? No one can remember that. None of us can remember that. But if we have some method to track it live on the fly, right? So that's why we use this method. Did you find any distinct differences in different age groups? So I think I just addressed that in that sense. Okay, so Samuel,
Divya has a next question on the credibility competition between the different platforms, especially WhatsApp and Telegram, right? The two big ones.
Yeah, I mean, definitely, a lot of people started migrating to Telegram. It's funny, they have slightly different personality characteristics in that sense. I don't know about credibility, and I have no data on this. But I have heard, following on from Sandra's question, I have heard parents comment, however, that they will never let their kids use Telegram because you can join with an open link with your number hidden, and it's much harder to QC, to have quality control on the content on Telegram because of that, right? There are many links that you can just join, and so yeah, and there are no limits on the number of people in the group, right? Whereas WhatsApp have some capacity limits. So I think they have different purposes. At NUS Canville, the residential group just joined Telegram precisely because of that number restriction. So there are some of these practical constraints that are changing the usage forms of WhatsApp versus Telegram. I don't have any data on this other than that.
One more question by Tig. So he's asking whether you examine the relationship between the well-being of the participants and their intensity or usage pattern.
Yes, we actually did that in our first study, the Singapore study, where at the start of the study and the end of the study, we administered the 21-item depression, anxiety, and stress score. We didn't find a very robust relationship. What we found was that, I think people who engage in more personal conversations about COVID-19, were more likely to have a different depression, anxiety, stress, because I can't remember the exact direction of this later on, but it's very subtle. However, we in a different survey, as well as many other people, have found that that the amount that you check news, especially from social media, does predict depression, anxiety, and stress scores across the pandemic. That has been found in quite a lot of studies now.
Thank you. Are there any other questions?
Maybe we can take there's just about 10 minutes left. Maybe I can take you wanted to talk about behavioral insights and
yes,
my work with there.
One question, which was whether you could share your experience applying behavioral science or behavioral insights into policy-related research. But maybe just before that, Sin has her hand up. Mm-hmm. So Sin, maybe you want to ask your questions first.
Oh, thank you very much, Samuel. And hi, Jen, this is Xin here. I'm Samuel's colleague at the Yale-NUS. I'm a research fellow. Joined last year. So thanks very much for the insightful talk. I found it very, very interesting, and the methodology is very relevant for behavioral science studies. So I got one question relates to the potential role of prior knowledge or prior user patterns in terms of how the different users engage with the COVID-related content during the crisis. So as you presented in the talk, all the observations are related to the current or the behaviors, usage behaviors after the COVID crisis has kicked in. So in that sense, could I understand that the data collected in SG and India, they don't include the observations regarding the prior usage or knowledge patterns before the COVID started. So if I understand that right, would you give us some advice or thoughts regarding if we're going to replicate the similar methodology for another areas related to the significant interventions for a topic? So how to get the prior knowledge like well represented in the data, so we can have the random controlled trials well set up to track the changes across different usage groups, so we can know like, okay, in terms of the changes in the travel behavior in the usage patterns, to this particular extent can be related to the significant event or the treatment itself, rather than people's like psychological responses or the behavior, how they believe whether it is true or not. Yeah.
Yeah, that's a very important question. And, after our first study, that was the question that was on our minds a lot. Are we just capturing baseline rates of usage? That, people who are chronic users are just those who are WhatsApp addicts. It has nothing to do with crisis communication. They are just WhatsApp addicts, right? And so, in our second study, we actually asked people to screenshot a lot more things. We asked them to screenshot, the number of messages that, WhatsApp has these objective metrics, right? How many messages have you sent? How many messages, we asked them to screenshot all of that and submit to us. We have a little bit of data on that. I hid it, but you can see it, let me share my screen now. So I told you the self-report data that we asked them how frequently you used it, but I also asked them, about to screenshot their metrics on the number of messages, the total messages they have sent, the total number of messages they have received. So this gives us some idea of baseline WhatsApp usage. Of course, you could say that it was during the COVID-19 pandemic that they suddenly had a surge of all these things, but it's hard to distinguish that, but at least we have a little bit more information. And I can say from that the chronic users are sending a bit more messages and are receiving a bit more messages. When I ask them to self-report how much time, they are spending a little bit more time on WhatsApp each time they use it. But because of this finding, where I asked how frequently, everyone is still a frequent user in that sense. So it's not like, we are only capturing, that chronicity in terms of, they're just the people who use WhatsApp, whereas minimal users don't even use WhatsApp. So that's not the case. To answer your other question about how do we generalize this and use this method in other crises, I'll tell you the decision making when we designed this study. It was actually very difficult to design. Typically, when you address a crisis, the crisis is fast. It's very, very hard to launch a study during that time. So for example, the Israeli kidnapping, if you had wanted to launch this particular method that we did during that time, the crisis is over in, let's say, 48 hours, it's gone. It's almost impossible to launch a study like that. I think the only corresponding circumstance that you could possibly, other than COVID-19, probably the only other event that you can track it over time is something like elections, which goes on for a long time, and there's a lot of a lot of elections chatter. But again, the elections chatter tends to happen in a certain group of people that may not be so generalizable. So it's actually generally quite difficult to repeat a study like that. But nonetheless, I think the characteristics that you found, in terms of, hey, can we identify these bunch of people who tend to get their news from WhatsApp? Can we identify these people who tend to believe rumors on WhatsApp? Those methods are easy to do follow-up studies on and repeat and find out more and actually characterize their non-crisis communication, right? So if you want to take this bunch of high-risk users and then now, as the COVID-19 pandemic is coming to a tail end, at least in Singapore, can we keep tracking their WhatsApp? We get to do that now. Yeah.
Thank you very much, Jen, for the information. Yeah, it's very useful to understand the methodology. And yeah, that's one follow-up question relates to for example, the potential impact from the self-selection, especially in the sampling process. As you mentioned, like it's hard to tell whoever responded to the survey or the interviews, they may have the self-selection effect. Like for behavioral science studies, we frequently get question about how representative your sample is for the particular population you are studying. So I'm wondering for the SG, for example, the SG study, in terms of the sampling frame and the sampling strategy, did you notice the potential like impact from the self-selection as well?
So again, this is really encouraging to me that I actually found similarities between my Singapore study and my India study, because I'll tell you, the Singapore study happened so fast, right? The pandemic just started, we went into a lockdown, you know, I was scrambling to get IRB, you know, scrambling to get all these things. So of course, when I had to recruit and, you know, we paid people, no grants at that time, we paid people $5 per participant. And of course, all the people that who joined were like in the university community. So I thought, wow, that's terrible. That's a terrible sampling design. You know, I don't know how generalizable this is. So when we launched 1 year later, it was with some grant funding and we could pay people. And this time we paid them $10 because we had so many more questionnaires that we loaded them on. But unbeknownst to us, you know, we thought $10, okay, a fair one. We asked quite a lot of our research assistants. Unbeknownst to us, many people in India thought that $10 was, wow, so much that they actually thought that we were scammers. And so because we were paying people so much, you know, we had such a huge representation of participants, huge ones. In the first sample, Singapore, almost all university students, university grads, highly educated. In the India sample, huge range across socioeconomic groups, you know, huge range, you know, as I said, we did it in English and Hindi. We recruited people through Facebook advertising. The demographic spread huge, and that really surprised us. And the fact that we found the same patterns on both times, very similar patterns on both times, actually tells us that, you know, that made us quite confident that, you know, this seems to be a general characterization of WhatsApp users. So yeah, I think your question is very important. I think if we just left off with the Singapore study, I wouldn't be as confident because we did it again with such a different context and found similar findings. I'm much more confident in my findings. Tech asks, would my data be made available for other researchers to use? Yes, with the IRB provisions. So, you know, and US IRB, oh, Misha, I'm sure this is true as well. IRB is very careful about all the PDPA laws. So staying within what they allow, yeah, that's what we can do. Samuel,
I think we have to bring it to a close. It's almost 2 minutes to 1 o'clock. So thank you very much.
Let me just, I'll just end off with you. I'm going to steal your last 2 minutes to tell to answer the question that you wanted to ask, which is, you know, for people who are interested, apart from this research, I do a lot of research on technology and its interactions with lifestyle. You know, your center is has a lot of applications to public policy. And I also want to tell you that, you know, if you want to do anything with my research group, I'd love to, because this whole other side of my work has to do with nudge, as Samuel introduced. So what we tend to do, our modus operandi, is that government agencies come to us from all across the board with any kind of question. So for example, how do I improve the wait time at service centers for CPF? How do I optimize a website for my government agency? How do I encourage users to use my new MRT line? That whole range of questions. What our modus operandi is that, you know, an agency will come to us, and then I'll deploy a bunch of students, and we will do many site visits, try to understand the situation, come up with an intervention based on nudge and behavioral science, and then run a randomized controlled trial on it. I'll love to have you talk more about this work if you're interested. Okay, thank you so much for hosting me, Samuel.
Thank you very much for sharing today. And this is part of our regular series of brown bag lunch talk. It's organized by LKYCIC. So the next BBL will be on 19th of May, and we'll be talking about environmental challenges and citizen concern, whether this is a false dichotomy. So this will be given by Rafael Martinez and also Hamza Yaqub, the center. So stay tuned for the invite that will be sent shortly. Okay, thank you very much, Jean, for your sharing today. We look forward to hearing more about your research when it's published. Okay. Thank you, everyone, for joining.